Hi, this is Brian Kim. I'm going to share with you this case of a patient with a moderately dense cataract, and you'll see double chop, cross chop, mechanical fracturing. The reason I'm posting this case is a very unusual vitreous opacity and actually looks like a water snake or some type of serpent lurking in the vitreous. And so when you see the eye here, this is the head of that serpent that's floating around in the vitreous space. And so go with me as I do this case and you'll see what I'm talking about. So I use a corneal marker to help me center and size my rhexis. And then I make my paracentesis incision, first on the right side and then the left side. I use a cotton tip to stabilize the eye as I do this, and I make sure I make an incision parallel to the iris plane, which creates a nice corneal shelf, which allows me to achieve a self-sealing corneal incision. This is intracameral lidocaine. You can see as I'm injecting the lidocaine, that little snake head pops up, and I'm moving it side to side, and it literally looks like it's kind of moving in the vitreous, like a water moccasin moving in the water. This is some dispersive viscoelastic. You can see I'm moving the eye with a can. You can see it looks like that's a snake moving in the water. This is a 2.4 millimeter bi-beveled incision. I stab the cornea near the limbus, go near parallel, wiggle through the cornea, using the cannula to control the eye, turn the eye towards me once I get to that mark, and then enter. I'm injecting some more viscoelastic to fill the anterior chamber, and then now this is the puncture style rhexis. I'm going to puncture the central capsule, pull downward, grab the edge of the capsule tear to create a flap, and then starting to go around circumferentially, trying to use a corneal mark to hopefully allow me to achieve a well-centered capsulorhexis. So after finish the rhexis, I burp some viscoelastic. This will be the Capsulorhexis hydrodissection technique. I place the cannula out across the contralateral incision, decompress the bag, and then turn the eye on the right side with the tip downward. And that's the Capsulorhexis hydrodissection technique. Irrigating the surface of the eye, lift the incision with a chopper, go in with irrigation off to minimize Descemet's trauma, remove the surface epinuclear material, place the chopper underneath the epinuclear ridge out to the equator, point the phaco vertically subincisionally, bring the instruments together, crushing the lens. That's the double chop. Place the chopper around the right heminucleus, pulling it centrally against the phaco crushing it and dividing it. That's the cross chop. I'm using a little vacuum and then placing chopper around that first quadrant, pulling the chopper centrally, crushing and dividing that first quadrant, and then using mechanical fracturing forces to crush the lens into smaller pieces, crushing the lens and sandwiching the lens between the chopper and phaco tip, and then once the pieces are smaller, emulsify the lens pieces. Place the chopper around the second quadrant now, pulling it centrally toward the phaco tip, dividing the second quadrant, separating it, using a little bit of vacuum to position the lens piece, and then using the chopper to crush it, and then emulsify the lens pieces. Just kind of teasing that last part of that second quadrant, lifting it up with some vacuum, crushing it between the chopper and phaco tip, and then emulsifying the lens pieces. Rotate the second heminucleus in front of me, place the chopper around the lens piece, pulling it centrally towards the phaco tip, which is deep in the bag, and dividing that second heminucleus, placing the chopper around the third quadrant, pulling it centrally toward the phaco tip, and dividing that third quadrant into smaller pieces, sandwiching the lens pieces and emulsifying the lens pieces, using a little bit of vacuum to pull the rest of the third quadrant up, crushing it and dividing it into smaller and smaller pieces, crushing it and crushing it into smaller pieces again, and then emulsifying the lens pieces. Turning the fourth quadrant in front of me, placing the chopper around the lens piece, pulling it centrally toward the phaco tip, and then dividing that fourth quadrant in half, using mechanical fracturing forces to sandwich and crush the lens pieces between the chopper and phaco tip into smaller and smaller pieces, and then emulsifying the lens piece. So again, this was a fairly dense lens. It wasn't extremely dense, but dense enough that I had to really be careful with breakdown of the lens pieces. So I'm removing the epinuclear material. I take the chopper out, and I'm going to push BSS in. You can see that little snake popped its head up as I did that. Take the phaco tip out, and then go in with the INA handpiece. I start sub-incisionally, sweeping side to side, peeling it off, grabbing it with some vacuum, and then mechanically pulling it upward. So grabbing it with some vacuum and then pulling it. That's my technique. You saw I grabbed the capsule a little bit in that last maneuver, so I switched to polish mode fairly quickly. You can see that serpent or water snake is still floating around in the vitreous space as I'm doing my maneuvers here. I'm polishing underneath the rhexis edge, peeling the cortical material, and polishing underneath the rhexis edge of any lens epithelial cells. And I've seen lots of different types of floaters, vitreous opacities, but that one is really very unusual. I mean, it does really kind of look like a water snake. So I'm polishing the posterior capsule now, making sure there's no fine cortical wisps on the posterior capsule surface, and then polishing underneath the rhexis a little bit more. I'm using a BSS cannula to pulse into the subincisional capsular fornix space. It looked pretty clean there. I'm going to inject some cohesive viscoelastic to fill the capsular bag. And then I'll use a sweep to polish under the rhexis edge of any remaining lens epithelial cells. Polishing with the INA does loosen some of that up, so when I follow that up with the sweeper to just try to see if I can get the remainder of it off. And as I polish, you can see that snake is really moving around a lot as I do that maneuver there. So now I'm injecting the single piece acrylic intraocular lens into the capsular bag. The leading edge goes into the bag while the trailing edge is left out of the bag. As it unfolds, I quickly go in with the INA handpiece, activate irrigation, make sure the haptics are disengaged from the optic, go underneath the optic, tilting it, and then rotating it 90 degrees clockwise, removing the viscoelastic from within the bag and underneath the lens, repositing the lens back, switching to polish mode, making sure I polish under the rhexis edge again, because sometimes there can be some fine cortical debris there, and then switching to the visco mode. And then I'll hydrate my incision. So again, this is double chop, cross chop mechanical fracturing techniques. This is a moderately dense lens. You saw how efficiently I was able to disassemble the lens with mechanical fracturing forces and using a sparing amount of ultrasonic energy. But really the reason I posted this was because of that really unusual looking vitreous opacity. It does look like a serpent or maybe the Loch Ness Monster's little brother or something like that. So that was the main reason I posted this case. I hope that was entertaining to you, and I thank you for your attention.